We're here to discuss the importance of palliative care with a special focus on its impact on women and families. Now, today, a couple of the topics that we're going to discuss will help you understand and advocate for palliative care. Let's start by looking at the agenda for this presentation and also some introductions and disclosures. Welcome, everyone, and thank you for joining us today. My name is Dr. Elena Prendergast, and I'm here to discuss the importance of palliative care with a special focus on its impact on women and families. Now, today, some of the topics that we'll cover will help you understand and advocate for palliative care. We're going to begin by having some disclosures and introductions, and then we'll look at our agenda. So you know a little bit about me. I'm a nurse practitioner who's dually certified in family practice and hospice and palliative care. I'm the founder of Tree of Life Health Consultant, where I serve as a professional quality of life navigator and end-of-life doula. I also have the distinct honor as serving as an assistant professor of nursing at Augusta University College of Nursing. Please note that all the information on these slides are my views and in no way reflect on Augusta University, and I have no financial disclosures. Here's an overview of our presentation today. We will start by discussing palliative care's definition, the benefits and goals, and then we'll discuss women as a special population, the impact of women as caregivers, and the financial implications of serious illness. Finally, we will discuss trauma-informed palliative care. Overall, the objectives for today is to provide you with an understanding of palliative care and its crucial role in supporting women and families. So let's get started. The primary goal of palliative care is to enhance the quality of life for patients by focusing on comfort and overall well-being. It provides comprehensive care that addresses the physical, emotional, social, and spiritual needs of those being cared for. Palliative care also supports families by providing resources, education, and emotional support. Examples of palliative care include managing chronic pain for cancer patients or offering counseling and support groups for both patients and their families. Many people confuse or interchangeably use the terms hospice and palliative care. Now, both are palliative care. Both palliative care and hospice focus on symptom management with a holistic approach that focuses on improving or maintaining quality of life. It's important to note that hospice care is a type of palliative care that is also a Medicare benefit, but there are some differences. Unlike hospice care, palliative care can be provided at any stage of a serious illness and can be given alongside curative treatments. The differences from hospice is while palliative care can be provided at any stage of the illness, hospice care is specifically for end-of-life care when curative treatments are no longer being pursued, typically with a life expectancy of 6 months or less. Now, one of the things I want to point out is that palliative care recognizes the family as a unit of care, and it involves them in decision-making and care planning. It's not just the patient alone that palliative care is focused on. It offers counseling, education, and support services to help family members cope with the challenges of a serious illness. Now, examples of this would include providing therapy for children or spouses to help them process the emotions and adjust to the changes. They facilitate family meetings to address concerns, to clarify goals, and to make collaborative decisions. Another benefit I'd like to point out about palliative care is communication and decision-making. Encouraging open communication is essential in fostering an environment where patients and families feel comfortable discussing their needs, their fears, and their preferences. Respecting patient autonomy means honoring the patient's values and preferences in all aspects of their care and ensuring that their voice is heard. Now, I think this is something really important to point out. Many families and many patients that have serious illness often complain that their needs are not being met when they want to be heard. So shared decision making ensures that patients' wishes are respected and that families are involved in all care decisions. This includes discussing advanced directives and goals of care. Now, this is a term many people may or may not have heard in the hospital setting or the clinic setting. So let's explore this just a little bit more. Advanced care planning involves making decisions about the care that you would want to receive if you become, and you notice I have this in capital, unable to speak for yourself. These are not things that happen after the fact. These advanced care planning documents take place when you are unable to speak for yourself. So the benefits of it ensures that your healthcare preferences are known and respected. It reduces the stress on your family members by providing clear guidance on all the wishes that you would have for your healthcare. These legal documents outline your care and your preferences, such as living wills, their durable power of attorney for healthcare. And this fosters an open communication with your family members about your wishes, your values, your goals, and it's really essential. Now, I'd like to point out, especially as myself, a woman of color, that these are very difficult conversations to initiate with your family. And oftentimes, many families don't want to have these discussions. But it is very important that you have these conversations, not just once, but over a matter of time, as our wishes can change over time. So we should be regularly reviewing these documents and our conversations. And we should update our advanced care plans to reflect any changes in your health or even any preferences that might be different and suddenly become more important to you. Now, consider what's most important to you when you're talking about quality of life and your medical treatments. You should discuss this with your healthcare provider. You should talk to your physician or your care team about your health, any treatment options, and any potential future scenarios. Where this really comes in line is when you're talking about something like cancer. You may be pursuing aggressive medical treatment right now. And although it might be difficult to think about this and feel like you are giving up hope by discussing the what if scenario, it's important to have those discussions with your healthcare team and your family so that if treatment therapy does not go as planned, they know what your wishes would be at that point. Now, after you've had these discussions with your healthcare provider, it's important that you complete the necessary legal forms and make sure that they're accessible to your family and your healthcare team. Now, one of the things that's important is that you make sure that you select a person to carry out your healthcare decisions, known as a healthcare proxy, that would honor the wishes that you would have. Does not necessarily have to be your next of kin or a family member, but rather someone that you feel could carry out those decisions the way that you have them written out. So that's why it's important after you've documented it for you to communicate with your family and ensure that they understand your wishes and know where they should find your advanced care planning documents. Now, I often recommend to family members, depending on the stage of illness, if a person is seriously ill, imminently dying, or on hospice care, I suggest that those documents may be kept on a refrigerator or somewhere close by. I suggest also that you make several copies and that your healthcare proxy would have a copy, your healthcare team would have a copy, that you would store a copy in a safe place, and then also any other family members that you may be living with at the time. Now, let's have a little discussion about palliative care and how it relates to women. The impact of serious illness on women is something that only recently has gained more attention, and it's being researched and discussed, and we're looking for funding at the national level. Now, research has noted that women are more likely to suffer from chronic illnesses such as arthritis, osteoporosis, or even autoimmune diseases. Conditions like breast cancer, ovarian cancer, and gynecological cancers are unique and distinct to women, and so therefore they require specialized care. It's not a one size fits all, and it's important that that is something that's taken care of and taken into consideration when we're looking at palliative care. Notably, it's important to note that women make up the majority of family caregivers. Often, they're caring for aging parents, spouses, or children with chronic illnesses. According to AARP, about 60% of our nation's caregivers are women. Now, this poses a significant challenge as caregivers often experience physical and the emotional strain brought up by trying to balance caregiving with other responsibilities, such as work and childcare. As a result, they experience high levels of stress and burnout. The cost of palliative care or serious illness can be significant, including out of pocket expenses for treatment, medication, and supportive services. There is a significant impact on women, as we've discussed previously, that they could be both patients or caregivers. Women often face financial challenges due to a loss of income, caregiving responsibilities, and healthcare costs that increasingly are rising. They may need to reduce their hours at work, often leaving their jobs altogether to provide care, which leads to financial instability. Now, understanding what services are covered by health insurance is vitally important. You need to understand your Medicare benefits and Medicaid potentially, as far as your insurance coverage. Now, understanding what is covered by all of these services is crucial to understanding what kind of help you can get in these situations. Now, those impacted by serious illness must recognize that there are nonprofits, organizations, or community resources that offer support and financial assistance, such as the American Cancer Society. Now, even government programs like Medicare and Medicaid can provide coverage for certain palliative care services. Now, you heard me mention previously that hospice is a Medicare benefit. Now, when you opt for hospice, hospice will have certain coverages that are mandated by Medicare. Unfortunately, to date, palliative care is what we call something like fee for service. And very few insurance companies are covering a lot of palliative care services. So it is important for you to pursue your particular insurance benefit to see what may be coverage and what you may be eligible for. Now, as we mentioned previously, women are the majority of our caregivers. And so it's important for us to consider support and resources. Now, providing support to caregivers is crucial for their well-being as well as the well-being of those that they care for. Now, available resources include those that I spoke about in the previous slide, but they also include community support groups, respite care services, which are available, and a benefit of hospice services. And this is when there is the opportunity to relieve some of the stress and burden on a caregiver so that they don't burn out. And hospice will provide that benefit to you as one of their services. There are also educational resources that are abundant in the community, also online, and through your particular healthcare provider's office. These can offer caregivers a much needed break, and it can help them to manage their stress and the responsibilities of caregiving. Palliative care for women must consider the unique healthcare challenges and life experiences of women. It's important to use respectful and inclusive language that acknowledges the specific concerns and experiences of women. Providing care that addresses not just the physical aspects of illness, but also the emotional, social, and spiritual needs is essential. For example, when discussing reproductive health impacts of treatments such as chemotherapy or radiation with a younger person, it is very important to have those discussions in advance of starting any treatments. Now, palliative care, incidentally, is something that should follow these women even after their treatment ends, because there are different emotions and symptoms that should be managed after curative treatment. Finally, an area that we're going to discuss in a little more detail is ensuring that we deliver trauma-informed care. Trauma-informed care is an approach that recognizes the presence of trauma symptoms and acknowledges the role that that trauma may play in an individual's life, especially in the context of palliative care. The key principles of trauma-informed care include safety, trustworthiness, peer support, collaboration, empowerment, and cultural sensitivity. So how do we do this? We do this by creating a safe space, that care environment is physically and emotionally safe for patients and their families. By fostering trust through transparency, reliability, and maintaining consistent care practices. By encouraging peer support and connections among patients and caregivers with shared experiences. Collaborating with patients and families in care planning, respecting their choices, and empowering them to make informed decisions about their care. Finally, we recognize the role that culture plays in the experience of individuals and their interaction with the healthcare system. There are 4 benefits that I've listed of trauma-informed care. Now, first, it enhances patient experiences, as it's been shown to improve overall patient experience by addressing the emotional and the psychological needs alongside the physical care that is being provided by the palliative care team. It shows improved trust and communication. By building trust and effective communication, this helps patients feel more secure and understood, leading to better adherence and to care plans that have improved outcomes. Something that I think that is really important that we should discuss is that there's reduced re-traumatization. By recognizing and avoiding triggers, trauma-informed care reduces the risk of re-traumatizing by helping patients feel safer and more comfortable. Now, some trauma is actually brought on at times by the treatments themselves. I spoke to an oncologist recently who stated that she was in the grocery store and someone walked up to her and said hello and reminded her that she was one of her patients in the past. Now, that patient indicated to her in a future conversation that after she finished speaking to her, this triggered her feelings that she felt while going through cancer, and she actually found herself going to the bathroom and vomiting. So we have to realize that sometimes the therapies themselves cause the patient's trauma. And finally, there is support for caregivers. Now, trauma-informed practices also support caregivers by acknowledging their experiences and providing resources to help them cope with the stress and trauma that is going on with their loved ones, as far as their therapies, but also the stress and trauma that they're experiencing as caregivers. Now, before we complete our presentation, I'd like you to consider two case studies. Our first case study is about a middle-aged woman with advanced breast cancer receiving trauma-informed palliative care. By incorporating trauma-informed practices, her care team was able to address her emotional trauma from past experiences, resulting in improved pain management, emotional support, and involving her family in care decisions. This ultimately led to improved quality of life. In our second case, we focus on a daughter caring for her elderly mother with dementia. The trauma-informed palliative care approach helped this daughter to recognize and address her own trauma from caregiving stress. By utilizing the respite care services that were provided by a hospice team and support groups, she was able to manage stress and improve her caregiving experience. Both these cases focused on care that was individualized, focused on quality of life, and took into consideration the needs of both the patient and the family unit. I bring these cases up to you because this is only one of many cases of palliative care. I would hope that as you have been listening to this presentation, you recognize that palliative care and hospice care are not the same thing. I hope that you recognize that this does not mean that you are dying. It is a way of empowering you. It is a way of advocating for yourself and your loved ones and getting the quality care that you deserve. To recap our presentation, I hope that you've learned that palliative care is crucial in improving quality of life for patients and their families, particularly focusing on the unique needs and the roles of women, both as patients and caregivers. I hope that you recognize the importance of trauma-informed care, the support systems for caregivers, financial considerations, and the importance of advanced care planning. I encourage you to reach out to your healthcare provider for more information on palliative care options, to utilize available resources and support systems for caregivers, and engage in advanced care planning for yourself and your loved ones to ensure that your wishes are known and respected. Additionally, I would like to strongly urge you to advocate for the inclusion and support of palliative care services in your community and consider the benefits of a trauma-informed approach. I'd like to thank you for joining me here today. If you have any additional questions, you can reach me through my contact information that is contained on this slide.